Morning to everyone that's joining us either via Zoom or on Facebook. First of all, I want to remind everybody we are recording this meeting so we can release it later on. We are also streaming it out on Facebook. If you have any questions, please type them into the chat for the speaker or general, and we can answer them for you. Make sure you get your answers. And with that, welcome to our November 25th, 2020 York County Community Sector Briefing. And I would like to introduce Laura McDougall, our Executive Director with Four Counties Health Department. Sorry.
Good morning, everyone. I just sent Lisa a message that we matched this morning. So we didn't plan that, but anyway, thank you for everyone for being on this morning and caring to hear about what's been going on in the community in the past couple of weeks. I know that there's been a lot of interesting and things happening here, and I'm excited to hear all the reports this morning from all the different sectors to get that feel for what's going on in the community. I first want to go over a little bit of data, and this is something I actually prepared for the public hearing last night, and so I'm going to just use it as I didn't have time to get just last night's numbers all thrown in here, but basically, we're up to, in the Four Corners District, 3,021 cases as of the 22nd. And York County was up to 924 cases. And in the past couple weeks, we had seen York County have 222 new cases. 89 were in the past week. We did have a little glitch with the Nebraska testing. It from a week ago, Wednesday, the test results were somehow delayed at the lab, and we did not get them last week. So that really actually cut down on our numbers somewhat for York County. They all came in this morning though, and we had at least probably 20 positives out of the Test Nebraska event. So that'll go push our numbers up quite a bit here for today. We've actually had probably 40 positive tests just come in this morning already based on some tests that came in. So in the Four Corners, and this is, so I wanted to also present some information about the Four Corners District. And I think this is something that was very, that they found useful last night in looking at what are the trends that we've been seeing in the Four Corners District, including York County. But in August, we're having about 39 new cases each week. We went to September and we had 59 new cases per week on average, and that was a 151% increase over August. In October, we averaged 225 new cases per week. That was a 381% increase over September. In November, we've had 421 new cases per week, and that's been a 187% increase over October. And in really looking at the trend, we are going up, up, up. And this is a trend we need to reverse. And now we're seeing that the hospitalizations are they lag behind the cases by a couple weeks, 2 or 3 weeks. And we're seeing that, our hospitals, it's not sustainable for them. They're really being impacted now. And as are the first responders, the long-term care facilities. Schools are suffering from staff shortages, and a lot of the kids are out either due to quarantines or due to being sick themselves. Local businesses are having problems with their workforce. So our community as a whole are really having a hard time. And I know that Jim's on today, So I'm hoping Jim can talk a little bit. He will. I know he will talk about what's being experienced at the York General. We know, at least within Four Corners, well, and this was from last weekend, so we know that our numbers have gone up on this as well in the last 3 days, but we know about more than 50 Four Corners residents who've been hospitalized so far in November. And so it's more than that now. But some of these people have been cared for in our local critical access hospitals. Some have been transferred out of our district to higher levels of care. So when you hear numbers from Bryan, St. E's, Omaha hospitals, Columbus, we have people being transferred to St. Francis in Grand Island, Mary Lanning. You know, when you hear about numbers in these hospitals that are going up, it's not just residents in those counties. It can be some of our residents as well that might have been transferred in. In our district now, we're up to 27 COVID-related deaths, and 9 of the 27 deaths have occurred in just in November. And I have quite a long list already of people that are pending to see what's on their death certificates to verify that it was COVID related on their deaths. So we have more people pending as well. So that's really the data that I look at, and at the trends and things that I wanted to share with you this morning. Our risk dial is right now in the red. And so you can, our risk dial takes into consideration many other different factors besides just the number of cases. It's the number of, it's the positivity rate on the tests, and it's the again the you know, what our situation is with supplies and contact tracing, and what kind of spread that we're seeing in communities and different things. So we're in the red right now because we are seeing lots and lots of community transmission. The new directed health measure that's in place right now is, and it's changed a bit from over the summer, where now we're looking at hospital capacities to see what's going to happen next. And as of yesterday morning, the state medical officer had told us that we're about 70 beds, 70 more. If we increase by 70 from yesterday in number of hospitalizations of COVID patients, we are going to be in the red, or in the most, things will be more restrictions in place. And I did look at the hospital beds this morning. We're down a little bit, so that's good. So we've had a little bit better situation today, but of course, you know, we're trying to get people home for Thanksgiving too. So, you know, things oscillate a little bit, but we are in a critical situation there. So to tell you also, on the Four Corners end, we are involved in planning for vaccines to be coming. We're planning in coordination with our partners that are going to be delivering vaccines. We do hope to start receiving some vaccine, possibly even some in December yet, but we expect it will trickle in, and it will be going to probably to healthcare workers. And we may only be able to vaccinate some of the healthcare workers. So we'll have to wait and see what our supply looks like. But there's a lot of planning going on. And then the last thing I wanted to say is that we are really recommending for Thanksgiving, everyone please be very thoughtful and careful what you're planning for Thanksgiving. This isn't the year that to have the big blowout for Thanksgiving. We're asking everyone to stick with your household members and keep your Thanksgiving small, just to protect everyone in your families. So I see it looks like the chat, there's been quite a few questions. So I might take a moment here and read some of those and see if I need to answer any of those quick. And then Tom, would you be able to just give a short blurb on PPE for us?
Sure. PPE at the moment is kind of holding steady. We're still able to for the most part, meet what people are requesting and everything. But again, that can change very, very quickly. So I will always encourage, reduction of usage, figuring out maybe different ways to group patients together so that PPE can be used in a more efficient manner and things like that. I know we are, at least for our long-term care homes, we're hopefully back on track with getting those Binex cards, the antigen tests, the rapid tests in for them. And we'll see, and just kind of keeping our heads down with the PPE and doing the best we can with it. So, but if there's questions on stuff or you need help with any of it, reach out, let us know.
Thanks, Tom. And then if it's okay, Lisa, I'm going to grab a couple of the questions. Do those hospital bed numbers include ones that are being transferred in from other states? So the answer to that is that yes, we actually, there is some cross-border patient transfer occurring, especially in like the Omaha metro area. They are taking into consideration what's going on between hospitals like Jenny Edmondson and Council Bluffs there is some transfer and surge capacity issues going on between those different hospital systems, as they're all part of kind of the Omaha metro area. That is all taken into consideration with this. I would say that we probably are sending more patients outside of our state at this point than we are having them come this way, though. I know we're hearing a lot of stories about patients being sent into Wyoming or Colorado for treatment. So, and into, like, I know that the Council Bluffs hospitals are also in play with this. So that is part of the whole numbers that are being looked at. Rod Woods had asked about, is there another option for efficient testing results for our workforce that Test Nebraska has no available test slots today? And there are options for testing I know that there's going to be a Test Nebraska in Seward on Friday, so that would be an option. So there might be other slots available from Test Nebraska. They wouldn't be in York, but you might be able to find some other slots with a drive to Grand Island or Lincoln potentially, or to Seward, or some different, maybe Columbus, some different places, so you can kind of shop around there. There's also options with York General, and with if you talk to your local medical providers, they may have some testing options available, and York Urgent Care. So there's also an urgent care in Seward, and you can try some of those options as well. We have pretty good test availability right now, but I think that of course, there's certain criteria that have to be met for the rapid tests and things too, which might make it a little harder to get one of those tests.
Can I mention something super quick about the testing, Laura, real quick? So with the upcoming holidays and things like that, especially with where the holidays fall this year, if you're worried about your employees being able to get into a Test Nebraska site and things like that, do make sure you're planning ahead, because like Christmas Day is a Friday. And so here in York, they won't be over in Seward, they won't be doing their Friday testing on Christmas Day. They're moving it to a Thursday. Same thing with New Year's Day a week later. And my understanding is those test appointments open up 7 days in advance. And so making sure that you're getting folks, signed up ahead of time for that kind of stuff, but do check the schedules, and don't think that they're not something that happen every day, at least not the Test Nebraska sites. But with the holidays coming up, they're going to be changed around a little bit. So make sure you're watching those.
All right. Thanks, Tom. And that's all we have for now. Thank you.
Thank you very much, Laura. Now we will move on to the medical sector, and I am going to start with Henderson Healthcare. Lisa Tesman, emailed me and said that on the hospital side, they do have a few COVID-19 patients. Otherwise, they don't have much different to report from any other week. And now I will call upon Jim Ulrich from York General.
Oh. Thanks, Lisa. A few things here to get to today, and I can chime in on the Test Nebraska situation in our campus today too a little bit. The outpatient drive-through testing, as one of the solutions that Laura mentioned, is one that requires doctor's order, and our schedule is going to remain basically the same this week, other than no testing on Thursday for Thanksgiving, and Friday may be a day because the clinic isn't open on Thursday either. Or there won't be much going on for in the way of doctor's orders that would have Friday testing, but we are planning on testing as demand calls for it on the weekend, like we've been doing, and then next Monday twice as well, like we've been doing. So from a Tuesday to Tuesday volume standpoint, which would be the 15th through the 22nd, I guess that's a Tuesday to a Monday, anyway, 15th to 22nd, we performed 163 drive-through tests that netted 48 positives. And then furthermore, we had those 86 tests that were done at Test Nebraska that are now being resulted that Laura talked about, unfortunately, due to a mishap down there. And what I do know is for today, we initially last night had 200 signed up for our Test Nebraska. Now, what's happened is that I just found this out a little bit ago too, through some digging we did in communication with Test Nebraska ourselves, is that we had a number of Lancaster, Douglas, and Cass County individuals that jumped onto our site because Omaha and Lincoln were full, is what I hear. And there's also been a situation of being pegged or full in Kearney as well. So sites around us are filling up. We got that squared away because I think there must have been some opening up of capacity or something at other sites. That now, today, what I'm hearing is we'll just have about 130 to 150 signed up, and our max is supposed to be 150. And that's what a lot of surrounding communities are kind of trying to go to from a staffing perspective. And so, Rod, that's what happens there. We get filled up, but it's not just York residents, unfortunately, it's others around that are jumping on and getting on where they can, kind of like you mentioned, where to other sites, maybe to go to Seward or something like that. So that's happening around us. So Test Nebraska is full again this week, has been talked about. Over this past month, this is something I mentioned last night at the hearing too, we've treated 39 COVID positive patients on our patient floor. And 25 of those have been discharged to home, 4 to nursing homes, and 3 transferred out and for further care. And 7 are still in-house today, even too. And that is the highest we've been for COVID-19 patients. So since the beginning of November, we've held pretty constant to around 4 COVID positive patients at least. Sometimes it's been 5, sometimes it's been 6, and now 7. That's important though too, because once we hit the 3rd patient, because we have a negative pressure individual rooms, once we hit that 3rd patient, we have to shut down our hallway, our east hallway, and make it entirely negative pressure, which we can do through air scrubbers and ventilation outside. And so it's just, that limits our bed capacity. So that takes 11 beds out of service, making them all COVID available. And through that, we only have 9 beds that are available. You need 1 for the staff for their supplies and everything, and then 1 for outpatient testing. I'm just going to call it the BAM drug. The new drug that's out there that those COVID positive patients could come in and get, their medication through that COVID positive floor or hallway as well. So today we actually did meet on that, and today our census is 14 in our whole organization, or on our hospital floor. And so we've got 7 down the second hallway, which is for non-COVID patients, which has a capacity of 11. So we've got 4 available beds, plus there are 3 LDRP beds, which are for labor and delivery and postpartum, which I'm not on the safety huddle as we speak, so I don't know how many we have in the labor and delivery rooms. So capacity's tight already from that, and we've only got 2 available spots for additional COVID patients. So what we're talking about doing is we're going to build a wall on our second hall at this point in time. Not going to turn it into COVID second hallway, but we will be ready to do that if the need arises. And that's if we get to like that 9th or 10th patient, we're going to have to go to the other hallway. What happens to the non-COVID patients? Because we have waivers from the state right now, we can turn our outpatient surgery unit and our 8 beds in our outpatient surgery pre and post-op rooms into patient rooms. That gives us 8. What that does, if we have to go to that direction, it really curtails surgery. We basically have to shut down surgery except for emergency surgeries in at that point. We don't want to do that. We obviously don't want to do that. That hampers our ability to treat all patients, but desperate times like this may call for desperate measures, and we just hope that that's not going to be the case, because we are trying also to transfer a few patients and have transferred 1 to the Hearthstone yesterday, and looking at avenues for another to do that as well to free up capacity. So we're trying what we can, but the COVID patients that are in don't turn around real quick. They can be up in there for multiple days. So it's a challenge that we're dealing with, real life challenge right here, right now, today on that. We're also checking as we can with Lincoln hospitals too, particularly if COVID patients turn a little worse. We're looking for an avenue and making up decisions on what we can do with those patients to move them on. So the hospitalization statewide dropping is a good thing, particularly going into a Thanksgiving holiday, because we've seen the holidays and what's happened a few days afterwards on past holidays, and that the trend has not been good, on that. And so, as Laura mentioned, we don't obviously want to keep those hospitalization levels below somewhere around the 1,050, somewhere in there, Laura. I know it's close to that number. That's set up as a directed health mandate change, as Laura mentioned, with the governor, but it's set that place for a reason, because that is really that threshold where it gets to a really critical stage of hospital capacity to at that point on a statewide level. So things have certainly changed in our hospital world here in the last month. So in addition to that, over this last month, we've seen 77 COVID positive patients in our ER, and with 41 of them transferred home. 31 of those were admitted to our patient floor over the last month, and 5 transferred out to either Bryan Health or St. E's. And overall, we've seen an increase in both our hospital census overall numbers, probably due a lot to COVID, but other patients as well as our ER. So it's not just COVID. But what I heard this morning in our incident command meeting was yesterday, it was mid-morning before we saw anybody through the ER that wasn't a COVID patient. So it's happening with great frequency. So right now we have elective surgeries going on still, as long as they don't require a bed. I am going to give you some good news here, though. Just hang on. So we are down to, at the Hearthstone, just 1 positive resident at this point in time. We were up to 6, and 1 that's in our hospital that's getting care right now too from that, from the Hearthstone. So there's a few positive staff right now, but ones that have no resident exposure. Great news there. 5 of the 6 neighborhoods in the Hearthstone are now green zone restrictions. That opens up things that we can have admissions right now into the Hearthstone, and it's an exhale. It's a little sigh of relief certainly there. And I think the one hallway that had the COVID positive patients is more in a yellow restriction now. So, and so things are going they're going better, knock on wood right now, because we're doing still the multiple times a week testing over there to keep our arms around it. We are also turning around and going to start testing Willowbrook. We're going to test again Willowbrook staff and residents. And we're also going to start doing that over at dialysis, because there have been a few dialysis patients that we've dealt with that have been positive. And having to, our new isolation room has come in handy. Our dialysis unit is full too. It's up to the full 24, that we can handle on that end. And so a lot going on in that regard, a lot of good, some good blips on the screen for hospitalizations. Hopefully that continue to come down and we can breathe a little sigh of relief. But I would entertain any questions that anybody would have at this point in time.
Jim and Laura, would one of you be able to answer Tammy's question? And I could see that going to more than just Region 5 to some other programs like them. I see Laura nodding.
Yeah, I can take that one. We do have healthcare workers that are in settings that are not hospital, not, clinic, those traditional, so there are other healthcare workers out there, and we do plan on, there is the priority group of healthcare workers. So we understand that there are some in the that do direct patient care that are in the non, hospital settings and things. So we do want to make sure we know where they are, and our planning, we do have them in the plan to receive some vaccine.
Laura, just to tag on for Tammy, and I know you didn't ask this question, but in preparation, what we're doing to at York General is we are placing an order for a negative 80 degrees Fahrenheit freezer, the ultra freezer for the vaccine that's coming, our way. I think if we don't get it in time, we've been told that it can stay in a regular freezer for up to 5 days, but you need to have the ultra freezer then at that point, so we can be prepped and ready for when that happens. And we had designs to get that on order, but there was a period of time which we weren't exactly sure which vaccine we were going to get and if we were going to need the ultra cold freezer or not. So it's good to get that on order and get that taken care of. So we're prepped, and I see that Henderson has their freezer already as well. So good news on both those fronts to be prepped and ready for the vaccine. So thank you.
Thank you very much, Jim. Do we have anyone else on from the medical sector that would like to provide an update? Okay. Jim, take a look at Tammy's comment when you have a moment, and we will move on to the education sector. Mitch was not able to be on this morning. He did email me his, so I'm gonna read it to you guys. He said, YPS continues to be very proud of our students, staff, admin team, and Board of Education. The past few months have been very stressful. We made a calendar change for the end of the semester. Our last student day will be December 18th. We will have academic intervention / teacher work days on December 21st and December 22nd. These 2 days will give teachers time to help struggling students finish the semester, and we want our teachers to utilize this time to get their grades completed so they can go home for Christmas break and not worry about school. We also released a possible hybrid instructional schedule to our families last Friday. We have been evaluating our plan, and if our community spread continues to rise and we see the virus is spreading in our buildings and we can't control it, we would then move to this plan. I want to stress that we are not doing this now. We believe this hybrid plan gives us a better chance of keeping our middle school and high school students engaged in learning. Our goal is to stay focused on our safety plan, and Mitch wants everyone to have a great December. I don't see Brad, but we do have a lot of cell numbers. Brad, are you on one of the cells and want to provide an update for Heartland? Okay. Your college did, they're on here, but they did text me. They have no update other than they are on Thanksgiving break, but because they are on here, if anybody has any questions, they're willing to answer them. And Southeast Community College, I don't see Heather on this morning. So we will move on to the local government sector. Barry, do you want to start?
Sure. Good morning, everyone. As it was mentioned last night, we had a public hearing of the City of York Board of Health, and we passed a mask mandate, a temporary mask mandate. Is like, I keep liking to throw temporary in because I don't want to make it feel like it's going to be here forever. We will get through this someday, but we did pass that. So we will get that information. I think Melanie already has an article out and it'll be on Facebook. We'll get a copy of that so Four Corners can have it on their website and YCDC, and we'll get it on the city site so everybody knows. But we tried to follow something that we think will accomplish what we're trying to accomplish without taking it too far and really farther than we need. So the only thing that we changed from the original mandate that was kind of a little bit based on Kearney is that we originally it was through the end of February, and we changed it to January 15th last night by the board, just to reevaluate, and we'll reevaluate it prior to that to see if we can remove it or if it needs to be extended. And the numbers will tell that, not emotions but the numbers. And I guess I appreciate everyone that showed up last night. We had a good crowd and people that talked on both sides of the issue, but I do want to really appreciate the health professionals that were there last night that provided that information. And as I said at the meeting, if I don't rely on health professionals to make this kind of decision, then I'm not sure who I would rely on. So I have a lot of trust in our health professionals. York is blessed to have them. And so that's the guidance that I felt like was necessary to follow. So with that, the ordinance goes into effect next Monday. That gives people time to understand what's going on, and just hope that everybody would embrace that and try and comply with that. We don't want this to be turn into an issue of any confrontation or having the police be bogged down by this, but just to have citizens just follow this resolution for a few weeks, and let's see if we can get through this and help keep those hospital numbers down. So with that, city buildings, are part of that. So we'll have masks in all city buildings, trying to keep our staff safe. And the goal of this whole thing was not to close things down, but to keep businesses open. And I've had calls from business owners already this morning that appreciate that. They don't want what happened in the spring to happen again when they're called and told they have to close down. They want to stay open. We want the school to stay open. We want activities to happen. I mean, this is something that we're doing to keep things open, not close them down. So with that, I would answer any questions also, but God bless everyone and happy Thanksgiving and stay safe.
Thank you very much, Barry. I did not receive via email any other updates. If there's other communities that want to speak, now would be the time. I know a few of you are on. Otherwise, we will move on to faith, community, and nonprofits. Is there anyone representing that sector that would like to speak? Okay, so we will move on to business sector. I only really have two things. First of all, I would like to encourage everyone to just continue to shop local, be kind. You know, things are going different. They're different right now, but our businesses here really could use your support. They have supported us, our fundraisers, our sports, our capital campaigns, you name it. Our business community has stepped forward to support us over the years. And now, especially on the retailers, November and December is their biggest months typically, a little bit of October. So if you could, whether it's online supporting our local businesses or through gift certificates, or you go in and buy something, keep your shopping in York County. It would be greatly appreciated by our local businesses. And the other thing I have is I want you to have a happy Thanksgiving. We will pivot, and Laura will probably talk to this a little bit, but we'll go back to our Thursday meeting in 2 weeks, and we'll pivot as we need to. For the businesses on the line, if you have questions, I helped somebody this week with their verifying unemployment for an employee who was off for COVID. If you're having trouble, please feel free to reach out. I can help you troubleshoot or connect you to the right person. Madonna, you would be up next.
Thank you, Lisa. Good morning, everyone. I do want to wish everyone a wonderful Thanksgiving that we're coming into. Our office team has been really busy and committed and focused on supporting our business community throughout the entire year, but we've put together a plan to help our residents know that we have safe shopping environment here in York. A lot of our businesses have opened up for Sunday hours. Those are listed on our website. We will be kicking off the holiday season this Saturday with the National Small Business Saturday, and our merchants have provided just about $4,000 worth of gift cards that we have distributed in thank you bags, 350 thank you bags throughout the community. And when people make a purchase, they will be appreciated with those bags at the time of that purchase while those supplies last. I did have a great meeting with Santa Claus yesterday, and he will be here Saturday morning from 10 to 12. We have a wonderful outdoor area for him to greet little ones, take a little picture, maybe take that Christmas list from them. We've put a lot of thought into having a really good, safe environment with Santa on Saturday morning. And then he will be hosting kiddos at the Santa Hut, and we will be posting a video, probably next week, on how families will come and enjoy bringing their letters to Santa in a good, safe environment, and it should feel normal. we think it will. So we really, really appreciate everyone supporting our community, our schools, our healthcare system, as well as our businesses. I've said it time and time again, the amount of support that we all give one another as we move through good, bad, and ugly, it's phenomenal, and I wouldn't want to be anywhere else. So happy Thanksgiving to everyone, and I hope to see everyone strolling about with their family units Saturday morning.
Thank you, Madonna. And Stephen, you messaged me that you have an update for York County Health Coalition.
Yeah, just sit on the board of the coalition. I just kind of wanted to remind everybody that if you, any of your employees, people at your church, contacts you know are struggling, whether it's due to COVID or not, there are lots of resources available through the Health Coalition that you can contact, especially as winter is coming, things are getting colder. We want to make sure nobody loses access to heat, electricity, the essentials, food. So just kind of keep everyone around you in mind and just kind of pass that information out as things are shared on Facebook, just because you never know who's struggling behind the scenes, behind closed doors. We just want to make sure everybody is taken care of in the community. So again, just reach out to the York County Health Coalition if you have any questions or ideas on that.
Thank you, Stephen. Well, if anybody has any questions or anything else to report on, now would be the time. Otherwise, it looks like I don't see anything on Facebook or in the chat. So everybody have a great Thanksgiving. And we will come back together in 2 weeks. Please feel free to reach out to whoever you need to, whether it's myself, Madonna, Laura, the hospital, the Health Coalition, the community. We're all here to help as we move forward. As Madonna said, we just got to come together as a team and work through it. So that's all I have. Laura, do you have any final thoughts?
No, thanks. And everyone, we do wish you all a very, very happy Thanksgiving, and stay well and be safe.
Okay. That is it. We will see you in 2 weeks for our next community briefing.
Thank you, Lisa. Thanks, Madonna.
Thanks, Laura.
Thanks, Laura. Appreciate you.